All right, let me tell you something that frustrates me as a physician. The average wait time for an autism evaluation can be 6, 12, or even 18 months in some parts of the United States, and that wait is maddening. The reason why children have to wait that long is something that I think warrants us going into and talking about. Also, what can you do when you're faced with a situation where you and your pediatrician feel like an evaluation is warranted, but the wait is months long? We're going to talk about why getting an evaluation early is so important, what to do if you're faced with a long wait, and things that can help move your child's development along during the process. All right, I want to explain to you why there's such a long wait in the United States for a developmental or autism evaluation. The reason is because there just aren't enough clinicians to do the job. In the United States, 1 in 31 children are going to be diagnosed with an autism spectrum disorder, and that doesn't include other neurodevelopmental disabilities like ADHD, intellectual disabilities, or other learning problems. So this is a very common problem, but there are only 750 to 800 developmental pediatricians in the United States, and there's also a shortage of clinical psychologists. We are the two specialists that typically do autism evaluations. And you can see by the fact that there's such a shortage of clinicians that when you have a concern, your pediatrician has a concern, and you get referred for an evaluation, why commonly families are sitting on these lengthy, maddening wait lists. All right, what happens during the wait? While you're waiting for an evaluation, your child's brain is developing at a very rapid pace. And we know that early intervention or receiving interventions that are targeted for your child's difficulties as early as possible is going to help them make the most progress towards being independent, happy, and successful later in life. This is not to make parents feel guilty. This is really just so that you can understand that because we have a shortage of providers and the importance of being seen early, or as early as possible for your concerns, are things that we need to pay attention to and start to address. What can you do right now to make a difference? Well, the easiest thing is to make an appointment with your pediatrician or your family doctor to talk about your concerns. In a lot of situations, parents will wait until the next well-child checkup and bring up their concerns about their child's development, but this can have a negative impact because your pediatrician has a lot of things they have to cover during that well-child check, and you want to make sure your child's development gets the time it deserves. So while development is screened often during well-child checks, sometimes you need to get more history, more information when a concern is there. So it's better to make a separate appointment with your pediatrician or your family doctor to talk about it. Your pediatrician or your family doctor can conduct a screening. If your child's young enough, they may give you a tool called the MCHAT, which is a screening tool for autism spectrum disorder. However, your child's older, your pediatrician may use a different screening tool, or they may ask you a lot of detailed questions about your concerns. Then together, you can come up with a plan about how to address the concerns that you have. In most states in the United States, you do not need a formal diagnosis to be seen by early intervention to get the ball rolling and to start your child getting and receiving the services they need now. But if we want to know what the underlying cause is for your child's developmental concerns, then a diagnostic evaluation is what you're looking for. And that's where the long wait can come into play. You want to get on as many wait lists as possible. The more you spread your eggs into different baskets, the faster you'll get off one of those lists and to be scheduled for a comprehensive assessment. The diagnostic landscape is changing dramatically. When I started practicing as a developmental pediatrician 26 years ago now, there really wasn't anything other than to get on a wait list and just wait the time it needed to get your assessment and then start intervention. But fast forward all these years later, there are tools out there that are very accurate that can speed up the process for you and your child. Tools like EarliPoint, which is an FDA-cleared eye tracking technology that can be used for young children to assess concerns related to autism can be completed in a matter of minutes instead of hours. And a lot of practices are starting to use them as a way to fast track children through the diagnostic process because of how accurate the technology is. And this allows practices to prioritize children to get them through as early as possible and into services without sacrificing the quality of that diagnosis. Some children may need additional testing depending on the results, and this frees up specialist time to spend that little extra time needed if a case is more complicated, but also allows for children to be seen quickly in straightforward cases. The goal isn't to replace comprehensive diagnostic assessments. You definitely need somebody who's a specialist to be able to take your history and make sure that there's enough there to be concerned about. But tools like EarliPoint and eye tracking technology can really help increase your confidence in the diagnosis, give families the answers sooner so that they can get into treatment, and really move the needle on helping families get into services during that critical window of development.